Hi, so we are going to go through a spinal flow, a sequence which is really going to get our spine working, moving, and it's going to help anyone who has pain through their back and somebody who's feeling really stiff. Okay, so I'm going to turn to the side so you can see how this one works. And we're going to start off with what we call flexion and extension. So my feet are about hip width to shoulder width apart, nice and stable. And we're going to move in time with our breath. All these movements are in time with our breath. So we're going to take a deep breath in as we arch the pelvis forwards, the head back, breathing in. And as we tilt the pelvis back and bring the head forwards, pulling in through the core, we're going to breathe out. Breathing in. And breathing out. Breathing in. And breathing out. So these movements should be slow, relaxed, and led by the timing of our breath. And we're moving with a softness, so we're allowing our body and our nervous system to drift into the parasympathetic. And parasympathetic means rest and digest, rest and heal, rest and recover, rather than the all-action sympathetic fight or flight nervous system. Let's do one more together. Breathing in. And breathing out. Good. We'll come back to neutral. And it's always nice to take a second for the movements to really just drop into your nervous system. So it's always good, rather than just rushing into the next exercise, just take a second. And just see how does that movement meet your body. Let's do the next one. So, we're going to start off by rotating our palms in. Let's take an inhalation. And breathe out. And now we begin our rotation. So I'm going to rotate to the right, growing tall through my spine, opening up through my arms and shoulders, my torso's turning, my head turns, and then my eyes turn as far as they can. And then I come back to center. Uncurling. Arms rotating again. Open the palms up. My body turns. My head turns. And my eyes turn as well. And then I relax back into center. Let's add the breath. Inhale, grow tall through your spine. Exhale and relax. Inhale. Exhale. Inhale, grow taller through the spine, finding that space within the vertebrae. Exhale, how much can you relax as you come back to center? Inhale. Torso turns, neck turns, don't forget the eyes. How far can you look round? Exhale, come back to center. So even though we're working towards our end of range, there's a softness to it. We're trying not to tense up too much. But of course there is a degree of tension in the body, but it's soft. There's no strain. And back to center. Let's do one more with breath. Breathing in. And breathing out. Lovely. And again, let's take a moment to allow the movement to integrate into the body. do movement 3. So we're going to make a flat hand and the other hand a bird's beak. So the thumb is going to touch all the fingers and you're going to curl the wrist in. It's important we keep the shoulders down for this one, and we're working our side flexion. So we're going to tilt our ear towards the bird's beak and push away slightly with the flat hand. So we'll breathe into center, change the hands and breathe out. Breathe into center and breathe out. Pushing away with the flat hand. Breathe into center. Hands change. Breathe out. Push away with the flat hand. You'll probably feel that stretch by the side of the neck, through the top of the shoulder. There may even be a little tingling in the forearm and the fingers. That's okay. Because yes, we're working with the muscles, but we're also working with the nervous system. And the nervous system is getting a little bit of a lengthening, a little stretch to it. Allow the breath to lead, breathing in, breathing out, breathing in, breathing out, breathing in, breathing out. Let's do one more each side. Breathing in, breathing out. Last one, breathing in and breathing out. Excellent. Coming back to center. Give yourself a little shake and let the body integrate with its new movements. Lovely. Let's do the last of the movement, number 4. First, a couple of pointers. The way that I've been taught to do this is to take the neck down and to create a full circle with the neck. However, for some people, doing that can cause discomfort and problems with the neck. So we'll give a couple of variations where we drop the chin and we just circle around the first part of the rotation. So from the side, we come down to the front and back to the side. Rolling down and to the side. With the breath, it's breathing in, breathing out, breathing in, breathing out, breathing in, breathing out. And in truth, the breath on this one can be reversed. So let's try it. Take a breath in and breathe out to center. Breathe in, breathe out. Breathe in, breathe out. And what we're looking for here is a smoothness in our movement. And if this does feel uncomfortable, you can simply work the linear directions, which would be forwards and back, side to side, and ear to shoulder. Or we remain here, nice and relaxed. Good. Excellent. And they are your spinal mobility exercises.